Hello, everyone. My name is Rose Hazlitt, and I'm the Clinical Director of Region 1, New York START. I am pleased to share results from our poster with you today. Our region was fortunate to pair with a new medical director team in January of 2020, just prior to the COVID-19 pandemic. Given the many challenges of the pandemic, we knew we needed to find effective ways to meet our team's needs remotely. Psychiatric consultation was intended to be an indirect service, and we learned very quickly that it could be provided virtually to help teams better understand and support an individual's vulnerabilities. Between March 1st and December 31st, we provided consult to 55 cases. Our study assessed whether these consultations were related to increases in stability for a person and their team. We assessed stability through 3 measures at various intervals before and after consultation, each of which we hypothesized would significantly decrease following the consult. Our findings were quite promising. We found significant decreases in irritability, agitation, and hyperactivity ABC scores, as well as significant decreases in individual and team intensity scores from the START action plan before and after consult. And although insignificant, we did find trends in the reduction of crisis calls before and after consult. These findings show meaningful relationships between psychiatric consultation and stability. It is also a START tool that can be implemented with ease, both in person and virtually. These findings suggest that when a team receives consultation, they are better able to understand a person's medical, psychiatric, and mental health needs, reframe their perception of why a person is in crisis, and be better able to shift their approaches and meet that person's underlying needs. To highlight what a New York START Region 1 consult looks like for a real case, I would like to introduce one of our coordinators who has worked with a team who has benefited greatly from psychiatric consultation.
Hello, my name is Kelly Hanks. I have worked with Penny and her team through my role as a Resource Center team leader and most recently as their START coordinator. Penny was enrolled in START services on August 25th, 2017. She has a history of self-harm with hundreds of presentations to emergency departments. As a result, she carried many overlapping and potentially incorrect diagnoses. In the last 6 years, she has also been prescribed over 50 different medications with nearly 170 medication changes. You will see that during her time with START, Penny and her team received many START tools, including in-home therapeutic coaching, resource center visits, and a comprehensive service evaluation. Measures of stability are captured in this chart through the team's use for the New York START 24-hour crisis line, which they assessed 60 times prior to initial consultation, and START action plan scores. The consultation took place on March 25th, 2020, with an additional follow-up consultation on November 19th, 2020, as indicated by the green star. Following the consultations, there was a decrease in crisis calls, followed by sustained absence to crisis calls, as well as steep drops in START action plan stability scores. Ultimately, I'm excited to report that Penny's case was closed 4 months after her consultation on March 29th for stability. We theorize that it was in part due to the enhanced understanding of Penny's vulnerabilities with a clear path to treatment that gave this team that last bit of competence and confidence to reach stability.